Alright.
I'm ready.
Okay, so if we look at the back, yeah, especially on the like the mid to lower back, you can really see the paraspinal muscles here. So if we wanted to locate the UB line by means of these paraspinal muscles, we just, you know, find the height of the muscle at any given location. Yeah. You can kind of see how it's a little wide and then it gets a little bit narrower.
So you would follow that part?
Yeah, if whatever you do, you try to. I mean, I would try to stick to a consistent method. If some people really are more comfortable just doing a 1.5 swim line, but if you are gonna do that, then just stick to that. You know. Okay. But let's see. I'm gonna actually find the T7 first. That can be a better or more reliable way of finding things than to start off from here. Sometimes when the patient is lying down in this position, it can be a little hard to distinguish where like T1 is versus C7. So I find that this is his scapula right here. I find the inferior angle right here, and I go right to the middle. Okay, and this I'm gonna define for the time being as our T7. Okay, and I'm just gonna try to check to verify that it matches up. Okay, so this is T7, then we go T6, T5, T4, T3, T2, and T1. Okay, so yeah, this kind of matches up. Okay. Okay. So let me see. So right about here, yeah. Oh, thank you. Thanks. So let me see. Let me check that again. So 7, 6, 5, 4, 3, 2, and 1. Okay, so this is below T1. So if we're trying to find UB11, okay, which is Daju or the Great Shuttle, then what we can do is the paraspinal muscles at this level tend to be a little bit less distinct. Yeah, I can try to feel for them, but higher in the back, you don't have the influence so much of the paraspinals as you have, like, there are a lot of muscles going this way to the neck, and so you can be hard to feel the paraspinals at that level. So what I can do is just kind of approximate. This is the medial border of his scapula right here, so this is 3 sun, yeah, and I just take half of that distance. So this would be a good UB11, like 1.5 sun lateral to the spine at level of T1. So that's UB11, and most of this is just, this is if this is T1, then I go down to T2, and I just go lateral to that. Okay. And T3 is an important. T3 is UB13, face shoe. Okay.
The lungs.
Yeah, the lung shoe. Okay. So this is T3 right here. Okay. Again, this is the medial border of the scapula. Okay. Keep going to T4. This is going to be Jue Yin shoe. And as you get down here, you start to feel more distinctly like the paraspinal muscle. Like right now, I'm kind of plucking it. Okay, so oops. Yeah, T3, T4. So right at this level, yeah. Maybe a little higher. Okay, T4. Okay, I think this shifted or something. The other thing is that, he has a slight scoliosis, yeah. So that's another reason why it's good to use the paraspinal muscles. Because if a person has scoliosis and then you're just trying to draw straight lines, it's not gonna match up. So right here is the height of his paraspinal muscle right here. And kind of pluck over it. Okay. So 15. Let's see. 11, 12, 12, 13. Oops. 1, 2, 3, 4. Oops. Did I miss something? This is his T1. Sorry, T7. 6, T5. Okay, T6. 7, 6, 5. I think I'm a little high. Sorry, T7, T6, T4, T3. T2 and T1. Yeah. Alright, I think I marked it wrong. Okay, see T1. So T1, T2 here. Okay, T3. Sorry. T4. It's higher. T5. Yeah. T6 is here. Okay. T6. Here. And T7, yeah, is here. Okay. And here. Okay, so it's a little better. Okay. I can kind of continue on, but let me just find a few like significant points. So, some of the points that are used most commonly are the UB20 and UB23. UB20 is the backsheet point of the spleen. Actually, I'll find 3 points. Okay, so UB18 is the backsheet point of the liver, UB20 is the backsheet point of the spleen, UB23 is the backsheet point of the kidney. So those are 3 important organs. So we tend to needle those a lot. Okay, so first UB18. Okay, that's the liver shoe. So if you remember, the UB channel goes up until UB17, and then it skips T8. So this is T7 right here. Okay, and we'll skip at T8. Okay, and we go to T9. So the liver shoe is going to be level with T9. Yeah, thanks. Okay, so we find like the highest point right here. Okay, so this is T9. So T7, T8, and T9. Okay. So this is Ganshu, or the liver shoe. Okay. That's UB18. Then we want to do the spleen shoe, T shoe, which is UB20. So this is UB18. You go 19 and 20. Okay.